this is Dr. Jeffrey Hanna at Atlas Health Australia. And I want to speak to you if you've ever been describing or if you had a quote pinched nerve sensation, particularly in your neck, and what it's going to feel like if you've never had it before. It is a really, really nasty, pinpoint, sharp, stabbing kind of pain in the neck, between the shoulder blades, something like that, to where you really, really can't move your head. Now, what I want to describe is that it is not always going to be a pinched nerve. In fact, it's oftentimes something else. And so to help out with this, we're going to use a few little rubber bands just to illustrate a principle and the little picture behind us. So first and foremost, what you've got is you've got 4 different layers of muscles, ligaments, and connective tissue that are going to be holding all of the different bones, joints, and all that sort of stuff in your neck in place. It is what's going to be allowing things to move. And it's going to be as if applying a bunch of tension or pressure on these kinds of rubber bands. Picture a bunch of these going all sorts of different directions, and they're pulled in different angles based on the movements that you're doing with your head. So what I'm going to do is I'm going to illustrate something like this. So let's say that we've got all of those different muscle and ligament fibers, and then what we start to do is we start to stretch them. And we keep stretching them, and we keep stretching them, and we keep stretching them, ultimately to the point where, something gave. Now, I want to illustrate so you can see here is we didn't lose all of the rubber bands. So we're not talking about a ruptured muscle or a ruptured ligament. We're talking about just one fiber letting go. But why does that matter? It's because if you're moving your head or your neck at just the wrong angle to where even one little fiber gives way, it's going to send a signal to your brain saying danger, danger, damage, injury. And what's going to happen is right in that area, wherever it was, you're going to get some local swelling, which is necessary for healing. But what your brain is also going to do is it's going to say, we are going into lockdown mode, preventing anything else from moving at the wrong angle, either accidentally or intentionally, so that you're not causing further injury to yourself. And what's going to happen, number one, you're going to find that it is extremely painful, extremely uncomfortable to move your head and your neck. Why is that? Because everything's gone into lockdown mode. But in addition to that, because of the area that has the fun little injury, you're also going to have a really, really nasty sensation that is almost always, as people will describe it, sharp. And they're going to say, if I turn my head this way, it stabs me down between my shoulder. Or if I look up this way, it grabs me, it jabs me in the side of the head and the side of the neck, something like that. And this is what people are probably going to be describing as being a, quote, pinched nerve in the neck. Now that's not 100% true, because if you have a true blue pinched nerve in your neck, number one, you'll be able to see it on an MRI. Number two is that it's going to be causing you other issues down to wherever that nerve goes. If you've ever smacked your elbow, your funny bone, and you felt a shooting sensation, that's what it's like when you've got a true pinched nerve. Or what it's going to do is it's going to cause muscle wasting or weakness to where you just simply can't move things. That is what a true pinched nerve is. Now, there can be all kinds of different variations with that, but so many people, what they have is they have injuries to their neck that happened maybe just recent or a long time ago. And point is that the stress has added up over a long period of time, building tension through all of those muscles and ligaments over that period of time, till finally that proverbial, the straw that breaks the camel's back, the body can't handle that tension anymore, and then you wake up one morning after not sleeping particularly well, and you're in the shower or you're backing out of the driveway, and you feel the thing grab, go, stabbing pain, and all this sort of stuff. It's not that you've suddenly pinched a nerve in your neck, most likely. It's that things have been there, building up through the muscles, through the ligaments, and the result of that is something has gone ping, and now you have to deal with this sharp, nasty, stabbing sensation. Now, what that also means is that, okay, number one, you've got to put the fire out, get it to where things are calming down, settling down, and usually, assuming no complications, things usually do resolve well for most people. However, if you've had this as a recurring kind of issue, that is, it's been coming around, coming and going every few months or so, or if the problem is just not going right on its own, then what it means, more often than not, is that there's a condition involving the alignment and the support where your head meets your neck. And what that is doing is that's causing something to shift through, and that's producing this tension through your muscles and ligaments. The end result of that is that things are at full tension, and it's inevitable that eventually something is going to give way. So if you have been dealing with, or if you're currently dealing with what you believe to be a pinched nerve sensation, what I'm saying is that one of the most important things that you can do is check that alignment at the base of your head and in the neck to make sure everything is sitting, simply put, the way that it should be. And by getting that corrected, it gives your body the opportunity to do what it's supposed to do, that is heal and to repair itself. So if you have any questions or any comments about what we're talking about with the quote pinched nerve, this sharp kind of sensation, what we'd like you to do then is just share those comments or things like that on our social media, either here on YouTube, Facebook, Instagram, or you can check out our website, which is www.atlashealth.com.au, where you can find all kinds of different additional information about the particular and unique service that we offer for helping people take better care of their necks. This is Dr. Jeffrey Hanna at Atlas Health Australia, a passion and purpose for helping people enjoy a better quality of life.